Welcome to Cancer 101, an educational program especially dedicated to the African American community. Here we are in the middle of our Module 4 of our training, and this is where we will discuss what cancer screening is and ways to detect cancer as early as possible so we increase the possibilities for treatment. Screening for early detection of cancer means that a person is checking for cancer but has no symptoms of having it. Participating in these screenings can save your life. With cancer, your best shot is to find it as early as possible. That is the goal of cancer screening and early detection. It finds cancer before it grows and spreads. When cancer is discovered early, that is, when the tumor is just beginning and there may not be any symptoms at all. There are more options for treatment when cancer is discovered late. This is when it has grown too much and symptoms start to appear. The treatments are more complicated and have more negative effects. If cancer is discovered when it has spread, metastasized to other parts of the body, the possibilities of treatment are more limited and possibilities of survival is decreased. So, if you wait to visit the doctor only when you notice change, like a lump in the breast or unusual bleeding or discharge, you may have a more serious cancer. You should not wait to feel pain before getting checked for cancer, because cancer does not always have symptoms. That is why screening for some cancers can help, particularly as you get older. Your chance at a full recovery will be better if cancer is found early and the treatment could be less aggressive. Here, we have several of the screening tests for common types of cancers. We will cover each of these tests in more detail over the next few slides. Mammograms are the current gold standard for breast cancer detection. As shown in the picture, a mammogram is like taking an X-ray of the breast. There are 3 types of mammograms. A screening mammogram is used to look for breast changes, although there are no symptoms at all. These screening mammograms are used for early detection of cancer. As we explained before, if the screening mammogram shows changes in your breast, like lumps or inflammation, the doctor will probably order a diagnostic mammogram. In the diagnostic mammogram, more x-rays are taken, but they are taken with higher resolution. So the pictures are clearer and show more details of the breast. Because the technology is advancing so much today, it is possible to have digital mammograms. That is, like x-rays taken with a digital camera, like we do today with our cell phones. Mammograms are complemented with breast exams. During a clinical breast exam, the doctor will carefully touch your breast and under the arms to look for lumps, inflammation, or anything else that may seem unusual. In the breast self-exam, you have, instead of the doctor, touch your own breast to feel painful points or inflammation. It is also recommended to look at your breast in front of a mirror to find changes in sizes or deformities. Although breast examinations are important, some lumps can be found only with mammograms. Breast cancer is more common in women after age 40. However, younger African American women and men can also have breast cancer. In general, if you are younger than 40, you can have breast exams only. But if you are an African American woman, have a family history of breast cancer, or are older than 40, you should be more careful. Usually mammograms are recommended every 1 or 2 years, depending on your gender, race, age, and cancer risk. There is no doubt that regular screening for cervical cancer can save lives. The Papa Nicolau, also known as Pap test or Pap smear, is the current gold standard for cervical cancer detection. During the exam, the doctor introduces a tool, a wooden scraper, or a small brush along the vagina to collect a sample of cells from the cervix, the lower narrow end of the uterus. The sample is analyzed in the lab to find changes or damages in the cells. These changes may lead to early diagnosis of cervical cancer, even though the woman does not appear to have symptoms yet. The good news is that most changes in cervical happens very slowly, so they can usually be treated before cancer happens. The Pap test is not always 100% accurate. It is possible that you can have damaged cells, but the sample collected during the test does not contain any of them. However, the cells can be found the next time you have the test. This is why it is very important that you have regular Pap tests. Although it is uncomfortable, it lasts only 10 to 15 seconds, and it may save your life. Pap tests are complemented with physical exams where the doctor introduces the fingers through the vagina to look for abnormalities in the shapes or size of the uterus, vagina, ovaries, fallopian tubes, bladder, and also the rectum. Ready? Colorectal cancer, that is cancer in the colon or in the rectum. It is the more common among African Americans. The main objective of the CRC screening is to find polyps, small growths in the colon, or other abnormal conditions that could become cancerous. If polyps found during the screening are removed in the same procedure, there is no risk of them becoming cancerous. Although CRC is very aggressive, it is more treatable when it is found early. As you can see, there are different tests, each one with different objectives and risk. We will review these tests in the next slides. The FIT, fecal immunochemical test, and GAIAC test are used to find blood in the stool, which may be an indication that something is wrong in our colon. In the FIT, we collect a stool sample by using a kit provided by our doctor. If the sample has blood, the doctor may order a GAIAC, FOBT, which has 3 samples instead of 1, to be sure about the results. If definitely there is blood in the stool, other exams may be needed. A double contrast barium enema is a series of x-rays of the entire colon and rectum. For this exam, your colon is filled with a liquid that contains barium, a contrast material, so the intestines can be seen on an x-ray. The sigmoidoscopy and colonoscopy are used to find growths in the rectum and colon. The difference is that the sigmoidoscopy only reaches the rectum and the lower colon, while the colonoscopy goes all around the entire colon, including the upper part, which is not reached in the sigmoidoscopy. Before the test, you need to clean the colon, drinking a special solution and following a special diet. During the exams, you are sedated and a small tube with a camera is introduced through your anus to look for polyps and inflammation. Again, polyps may be removed during the procedures. In general, it is recommended that people in their 50s and older be screened for CRC at least every 10 years. However, the guidelines vary according to your health condition and risk. Although the exams may not be so comfortable, talk to your doctor about your risk of CRC and the different options for you. Remember that early detection of cancer may save your life. There are 2 tests for early detection of prostate cancer. A digital rectal exam, DRE, is often part of a man's routine physical and is a standard way to check the prostate. The doctor inserts a lubricated glove finger into the rectum to feel for size, firmness, and texture of the prostate, as well as any hard areas, lumps, or growths spreading beyond the prostate, and any pain caused by touching or pressing the organs. Although it is an uncomfortable test, it lasts only 10 to 15 seconds, and it may save your life. The prostate-specific antigen, PSA, is a protein made by normal cells and also by prostate cancer cells. PSA is found in the blood and can be measured with a blood test. A PSA levels can rise if a man has prostate cancer, but a high PSA is not proof of cancer. Other things can also make PSA levels go up, like age. If PSA values are high, regular follow-up is recommended to see if the levels continue to increase or not. African American men and older men are more susceptible to have high PSA values because prostate cancer tends to grow slowly compared to other cancers. There is no need to have immediate aggressive treatment like removing the prostate. Currently, surveillance or periodic follow-ups are recommended. If you are a man with a family history of prostate cancer, do not delay talking to your doctor about the different options and best approaches to follow. A symptom is a sign of something that may not be right in your body. Though there are many different symptoms known to be connected with cancers or certain cancers, a symptom does not always mean cancer. The most important step you can take to detect anything wrong with your body is to pay attention to it. No one knows your body like you do. Be aware of what your body is telling you and any changes in appearance, comfort, and sensitivity. Most common signs of cancers are listed here. If you have any of these symptoms, go for a physical examination. Remember that early detection of any life-threatening condition may save your life. There are some reasons why some people decide against participating in cancer screening and early detection. In this next slide, we will go over a few. Here are some of the main barriers that people usually have to cancer screening. You avoid cancer screening because you are afraid of discovering that you may have cancer. You do not have cancer screening because you have no idea about what these tests are for. You may dislike these kinds of tests because they are embarrassing and an invasion of your privacy. Your doctor has not recommended you the tests, or you have not asked about them. You believe that cancer cannot be prevented or cured, so there is no need for screening. You would like to get the screening, but you do not have health insurance, or your insurance does not cover them. You are too busy to go to the hospital and prefer to do it at some other time. Which one of these barriers is applicable to you? Are there other barriers not listed here? By now, you should have an understanding about the works of early detection, the importance of recognizing barriers to practicing early detection, and the symptoms associated with cancer. We hope you have time to think about and talk about cancer screening with your family and friends. Together, we can make a difference in our fight against cancer. When you are ready, continue with Module 5 to learn about how cancer is diagnosed with the different stages of cancer.